Okay, so we're moving right along. We've got our final, you're teasing me, aren't you? We've got our final presentation of the day. I'm very pleased to welcome Hannah, although I won't be if she falls off the stage. Hannah Varto has been a nurse practitioner for 19 years, beginning her nursing career as a forensic nurse examiner in 2002. She has since led key initiatives in youth, women's, sexual, and forensic health. Hannah was the first nurse practitioner in BC to specialize in forensic medicine and has played a central role in establishing Canada's first outpatient clinic dedicated to providing medical care for survivors of recent violence, Embrace Clinic. In 2022, she expanded this work by founding a specialized strangulation clinic within Fraser Health to support survivors of this severe form of violence. Hannah is also actively involved in several research studies, including a multi-million-dollar study sponsored by the US Department of Defense, which is focused on developing blood tests to diagnose brain injuries related to violence. Over to you.
Thank you, Amanda. Okay, just stop before we play. Couple of things. So thank you for having me here today. There's a couple of things that have come up that I just wanted to take a little moment to talk about to clarify some pieces here. Look, Vinder said, after 7 days, then what do we do with these people? I'm going to answer your question today. That is Embrace Clinic. We had 24 reported cases in ARH last year. And that was before we had on-site nurses that were there 8 till 4 and whatnot. So Surrey saw some of those cases, not all for sure, but then people were transferred from this community down the road to Surrey Hospital out of their own communities. I don't have the numbers in front of me today. This afternoon we are going to look at statistics, and I too am a statistics person. I got Excel spreadsheets upside down and backwards, and I'll be sharing some statistics specifically about the history of forensic nursing service in Fraser Health and the advent and the growth and the kind of insane growth we've seen. And so I want to give credit to our Abbotsford nurses in that they are a teeny tiny team. They are like 9 people, and they could never have accomplished 24/7 coverage. And so when they couldn't, in some cases, Surrey would pick up that. So I think we need to look at 24 plus whatever was seen in Surrey from the Abbotsford community, but that also includes Chilliwack and Hope and Boston Bar and all those other things that are east that end up getting either to Abbotsford if there's lucky enough to have a nurse on call, or then to Surrey. Right. And so one of the challenges, again, and addressing our white privilege, Angela, someone online had asked, well, you know, all these nurses are like generally white upper middle class nurses. Yeah, we've had the privilege of working on call. On call is not an easy way. You don't make guaranteed money. It's hard to pay your mortgage working on call. You never know if you're getting called in. Childcare needs to be scheduled. And forensic nursing is unique. It is one-on-one, dedicated, time unlimited care. So when Christina goes in to see a patient, she might be half an hour to 2 hours. She might be 8 hours. And it's really hard to schedule your life around that. So I do think that primarily white upper middle class nurses had the privilege of potentially having access to things like childcare or being able to work part-time jobs. When our Indigenous or other racialized nurses may not have had that same privilege and access to be able to do an on-call job. And so I'm hoping now that we're introducing the 7 days a week, 7 a.m. to 11 p.m., so 16-hour coverage, is it ideal? No, we want 24/7 in every hospital, of course. But it's a really big start, and we are really excited, and maybe we can start to recruit some of those nurses to provide that diversity, because now we can actually give them a paycheck, a guaranteed paycheck. So I'm hoping that that's maybe one of the answers to that as well. And our services are all unknown until you know to need it. When you get breast cancer, you don't know all the services that are out there until you need them. And so that's why service providers like you are so important, because you are the ones who need to know, because the people are coming to you and you need to know. I would love for every human being in our province to know that forensic nursing exists. I actually don't want them to know that, because I don't want to see them, because I don't want them to be hurt. So those, when they do come forward, we want them to know. So we have to be easily accessible when it's time for them to be seen as well. And finally, the role of forensic nursing in Fraser Health. Christina had mentioned that, you know, it's run by nurses. and nurse practitioners. And we don't have physicians within the forensic nursing team, and we're an amazing collaborative team that does a great job. Our value might be in injury identification, but also the lack of injury and the explanation when there isn't injury. The vast majority of the cases we see, especially in sex assault, have no injuries at all. And then we get Crown asking us, well, why aren't there injuries? Our forensic nurses can explain that, and we can help to provide explanation to victims, police, service providers about why there are no physical or visible injuries seen in some of these cases as well. So these nurses that I work with, and hopefully myself, really are experts in the work that they do. And I'm hoping today we've emphasized that, we would like to be treated and worked with like experts, included at the community tables. And I think Embrace Clinic is just that extension of that. And I'm going to talk a little bit about it after I show you this video that was released today by Fraser Health, and I got permission to show it today, advertising our service. So I'll get you to play that, please. Is there sound? There is sound.
You've just experienced something violent, something scary, something traumatic. Forensic nurse examiners are here to help. Now, these highly trained nurses are here to support people of all genders who have recently experienced sexual assault or partner violence. If you or a loved one ever need their support, we want to walk you through what to expect. All right, so we're here to meet Hannah. Hannah, thank you so much for having us here.
Yeah, hi Zara, my name is Hannah Varto. I'm a nurse practitioner. I work with the Forensic Nursing Service in Fraser Health. Today we're at Surrey Memorial Hospital, and I'm going to walk you through what happens when we come to see a forensic nurse and what happens with the forensic nurse in our private suite.
All right, let's go inside. Great.
The whole thing can feel scary and overwhelming, and absolutely you've had some control taken away from you. And we're here to help you regain some of that control. We can't change the past, but we can maybe help things get better. First of all, you're going to meet with the triage nurse here at the triage desk. The triage nurse is going to make sure that you're okay. The nurse will take your vital signs and assess and ask you if there's any injuries or any questions about the incident. After that, they'll offer you the choice of seeing a forensic nurse examiner. And if you'd like to do that, then we'll page the forensic nurse examiner and they will arrive usually within an hour.
Okay, so it's the usual getting my temperature check, my blood pressure, all that sort of stuff. And then I have a choice after.
Absolutely. Everything we do here is completely by choice, and all of your options will be discussed with you.
Okay, and where are we heading next?
We're going to walk down to the forensic nurse examining suite, and this is a private space where you will wait for the forensic nurse examiner to arrive. In Fraser Health, our forensic nursing service sees people ages 13 and up within 7 days of their violent experience. You might meet with a social worker, you might meet with a victim support worker while you're waiting, or with the forensic nurse.
Hi, I'm Zara.
I'm Lorena. I'm the forensic nurse examiner.
I know we're here at Surrey Memorial Hospital right now, and I know you also have a team at Abbotsford Regional Hospital, but if I end up at a different hospital and I need your support, what happens then?
It's no problem. Patients can go to any hospital within Fraser Health, and once the emergency department team has determined that they're healthy and well and all of their medical needs have been addressed, they would call our consult phone and determine where there's a forensic nurse available, either at Surrey Hospital or at Abbotsford Regional Hospital.
And then would you help me transfer over there if I can't make my way over there?
Yes.
What happens next? Where are we right now?
As long as a patient's comfortable, we bring them back to this space here. This is what we call our forensic nursing suite. It's a nice, calm environment away from the busy emergency department, where our forensic nurse can sit with our patient and talk to them about options for care. The forensic nurse is here to provide information, talk about potential outcomes for decisions that patients get to make, and walk patients through the decision that's right for them.
This is where we decide what's going to happen in the exam.
Exactly. I move next door into our actual exam room where the physical hands-on care is done.
Now, do the police come here, or how do we make that decision on what actually takes place and who finds out?
We can offer medical care and we can offer forensic care. Medical care would be things like a head-to-toe assessment to make sure there's no injuries that maybe we need to address, or call on our physician in the emergency department to help us with. We review medications that might be helpful to prevent things like unwanted pregnancy, STIs, things like that. The other piece that we can offer patients is what's called a forensic exam. So a forensic exam is an evidence exam. So we're doing a very, very detailed head-to-toe examination, as much as our patients are comfortable with. If there's a part of their body that they don't want us to look at, we won't do that. We can offer that full forensic exam, and then the patient gets to decide what they want to do with it. They can either ask us to give everything to police because they do want to report the incident to police, and so we facilitate that, or they're not quite sure what they want to do, or now's not the right time, so we can hold on to that information, giving them time to decide what they might want to do.
Okay, so you've talked about choices in here, and then you head over to the exam room.
Yes, that's
Okay.
right. Yeah.
All right, so this is the exam room.
This is the exam room, yeah.
Okay. Walk me through what would happen the moment I walk in here.
And we might have an opportunity to collect clothing if the patient is wanting to release that to police. And then we move them into our exam space. There's sort of a wide variety of items that we might use during a typical medical forensic exam. Some examples include our alternate light source. So this is a light that fluoresces substances on a person's skin. It's just a blue light, and we use our orange goggles to help detect areas of fluorescence. Some other tools that we have here, we have our swabs. These are the swabs that we would use to swab a patient's body, both externally and potentially internally, based on the patient's comfort and consent. So we collect blood for two reasons, again, based on the patient's decisions. We can test medically, so testing for STI, things like that. And we can also do forensic blood work, which would be for toxicology. So if there's a possible drug ingestion that was part of the incident, then we could do some toxicology in the form of blood and urine. So as we're doing our head-to-toe examination, we're taking time to carefully measure each item that we see on the patient's body.
So say my tattoo is a mark
Exactly.
over there, you can measure exactly what that is.
We would come in and we would measure the item, and then we would document it carefully on our documentation. We can offer them forensic photography. So this is our camera system here. And with this device, we would, again, take now photos of every finding that we see on their body. Here we have evidence tape. It's really important that any forensic evidence that is collected, we're able to maintain chain of custody. This is another tool that we use. So as we're doing our forensic exam now, and we're taking our time to carefully assess and document all the findings, we would actually draw them on various body diagrams. So we would draw, let's say there was a bruise on the right shoulder, we would draw it here, and then on this document here, we would indicate all of the specifics about that particular finding.
So I'm looking at this room. Obviously, you've got the exam bed. You've got all of these tools, probably a lot for anyone coming into here that hasn't come into this space. Do you ask for consent throughout? Is it a continuous question?
Every step, yeah, every step of the way. And if our patient needs to stop or take a break, then absolutely we do it. We do what our patient wants and we go at their pace. Some of our exams can take 20 minutes and some of our exams can take 4 hours.
What would your message be to them about having the ability to make that decision and control it?
Know that we're here, know that we want to help, and know that you don't need to do any of this alone.
The forensic nursing exam is really only one step in your journey.
Okay.
If you choose, we can offer you follow-up care too at Embrace Clinic.
Okay.
Welcome to Embrace Clinic.
If I've gone through the forensic exam and I've decided I do want to be contacted by Embrace Clinic, how does that work?
All right, so Embrace Clinic will contact you within about 3 days after your hospital visit, and we'll offer you either a phone or an in-person visit appointment. The purpose of Embrace Clinic is to provide medical follow-up, and we can answer questions about your hospital exam, and we can treat things like sexually transmitted infections, injuries. If you've been strangled or maybe hit in the head, you might have a concussion or some head and neck pain, and we do a lot of work with that as well. Well, I want to remind people that we believe you, and we will support you and your decisions on what you want to do next. Our focus is always making sure that you are okay first. Then we can talk about all the other options after that. So when you walk through our doors, whether it's at the Forensic Nursing Service or whether it's at Embrace Clinic, we believe you and we'll be here for you.
So Zara, that was her pet project. She joined our communication team from the CBC, so it might have CBC flavor to it, but that got released yesterday and it'll be spread on social media. So if you go to the Fraser Health Forensic Nursing website, it is posted there right now. Please spread that widely and hopefully that touches some people. Surrey and Abbotsford expect an increase in patient volume for a little while. All right, let's move on. Oh, there we go. All right, so forensic nursing service in Fraser Health started at Surrey Hospital in 1992. About 5 to 6 years later, the Abbotsford program came on board. And this was an amazing service. I think everybody here, hopefully I'm speaking to the converted, think this is an amazing service. One-on-one specialty nursing care, time unlimited wraparound service. I have yet to hear a patient complain about the treatment they get from the forensic nurse. So many times forensic nurses get hugged at the end. Just people saying, I felt safe, I felt heard, I felt supported. Amazing care. And then the forensic nurse says, okay, it's time to go. And up until 2014, it was, here's a pamphlet for some counseling and maybe you can reach out to victim services. And, you know, those sutures we put in, you're gonna have to see your doctor. Or I recommend you get tested again for STIs in about 2 or 3 weeks, go see your doctor. And of course, what do you think the response is? I don't have a doctor. Or I'm not going to that doctor. That is my parents' doctor or my husband's doctor. Or I just, you know, this is not a 7-minute walk-in clinic visit. Right? This is not a hand on the door, one item visit for follow-up. So in 2015, the provincial government made some funding available for nurse practitioners in the health authorities. And the very astute coordinator at the time applied for 2 full-time nurse practitioners to join the forensic nursing service in Fraser Health. And I was one of those 2. It was a great fit for me because I was a forensic nurse beforehand. So in 2015, now the forensic nurses, instead of saying, go see your doctor and good luck navigating the system, they say, in a couple of days, you're going to hear from Embrace Clinic. Is that okay with you? And the patient says yes. They give us the best way to contact them. They provide us information around how to confidentially contact them safely, text, email, phone, and we will follow up. We give them their medical test results from the hospital. We often end up explaining some of the things that happened in the hospital. There's a lot going on, a lot of decisions that are made, and it's easy to mishear things when you're in crisis and trauma. We hope that by this time they've come down a little bit and we can walk them through some of those pieces. We arrange follow-up testing, wound care, suture removal, sleep assessments, all those things that you might go see your doctor for, but we are the specialty clinic. So when you go to the hospital and you have a heart problem and you're like, oh, I might have a heart attack, they clean you up at the hospital, just like our forensic nurses, make sure you're provided that urgent care. And then you're referred to the Rapid Access Cardiology Clinic, right? We're the Rapid Access Medical Forensic Clinic. That's what Embrace Clinic is. So what kind of care do people need after a forensic exam? This is going to be fun. Okay. So sometimes they need repeat STI screening at the appropriate intervals. If you're sexually assaulted today, me testing you for HIV today is not going to be accurate. It takes about 6 weeks. Actually, that's the window period for HIV. Chlamydia, gonorrhea is about 10 days. Right? So we need to make sure that we're testing and providing the right information at the right intervals. We might provide pregnancy tests and unbiased options. So if somebody becomes pregnant from a sexual assault, we will walk them through what their choices are and support them through that process. We will do some safety planning, of course. We will do management of any injuries, including genital pain or discomfort. I probably should have had the podium now because I've got too many hands here. Suture removals, mild wound or wound care, strangulation, head injury, concussion diagnosis and care. I am just going to put, yes, please. Okay, all of these things. That's okay. Sleep, access with emotional well-being, referrals for mental health supports, just ongoing contraception in some cases, and access with substance use services. We ask every person we follow up with about how their sleep is doing and how their mental health is doing, if they're feeling like harming themselves, or if they're coping by either using or increasing their use of drugs or alcohol. And we hope that we can sort of fit in there real fast. Next slide. Thank you. So how do patients before Embrace Clinic, or in the interior, for example, how do they get at their medical test results after their forensic exam at the hospital? And who's providing that information? Who's responsible for calling these patients? And is it in a trauma and violence informed way? Right? It's one thing to get a call when you've gone there and you're like, oh, it hurts to pee. And then a nurse calls you 3 days later and says, oh, you have chlamydia. It's a different thing to say, I was sexually assaulted. And then a nurse calls you and says, oh, sorry, you got chlamydia. So hopefully we provide a more trauma-informed test result, also explaining what that means, whether they've been treated or not, and how we move through that process. And do we know the safest way to contact patients? I will tell you that if you go to the hospital emergency visit and you break your leg, they're not asking you, is it safe to leave a message? What's the best way to contact you? They're going to call the phone number on your care card. We try to get information. We know phones get stolen, or maybe they're being tracked. So it's better to call their friend. It's better to text rather than phone somebody, right? All right, next one. All right, so connecting to follow-up medical care after violence is important. We know that it prevents a lot of things. We know that people who do not have medical care and supportive services after violence have increased risks of diabetes, heart problems, gynecological issues, post-traumatic stress disorder, suicidality, substance use. I mean, the list goes on. And the evidence is really clear. And so part of the idea of implementing Embrace Clinic was to maybe prevent some of these things from happening, maybe prevent their need to go back to emergency or having to explain their story over and over and over. And that's the beauty of Embrace Clinic, is I have access to the information that the forensic nurses collect. I don't need the story. I have the basics. I ask about symptoms. Now we can really focus on your medical needs, and I don't have to get lost in the disclosure of violence. Next one. So I think this was brought up in our group panel talk here, but violence is a healthcare issue. It's also a legal issue. It's also a social issue, but we only need to work together to respond. And I can't tell you how many times there have been these community forums and healthcare hasn't been at the table. We've been left out of the table. In the last few years, I think that's changing, but for a long, long time, you know, we'll come across these like, oh, do you see their meeting about like a community response to violence in Abbotsford? And no healthcare is at the table, right? So I'm really happy that we're here today and that we've made connections with Amanda to be able to coordinate and collaborate and bring this all together, because I think together is how we change this trajectory. Next line. So violence has often been treated also as a mental and emotional trauma, and we forget about the physical trauma. Let me give you an example. If I'm a football player and I show up at the hospital and I've been hit in the head and maybe I lost consciousness for a few seconds, coach says, hey, doc, think he's got a concussion. He hit his head, he lost consciousness, he's feeling kind of dizzy, he's got a headache. Doc's like, okay, let's do a CT scan, whether you need it or not. Full head and neck assessment, maybe some medications for pain, a referral to the concussion clinic, and a note for a week off work. She shows up, big goose egg on her head, and she's like, oh, you might have a headache. Here's a pamphlet for counseling and victim services. Does that sound familiar to anybody here if you've brought people for medical care, right? Unless you show up saying, I got hit in the head and I lost consciousness and I might have a concussion. Often violence has been treated like an emotional and mental concern only, and we forget the physical. Next. So this is Sheila Early, and she is the forensic nursing pioneer in British Columbia and in Canada. And I'm proud to say that many of us trained under Sheila. She is my mentor as well as many of my colleagues. She started the 1992 Sexual Assault Nurse Examiner program that then became the Forensic Nurse Examiner program in and around 2007-ish, when we implemented domestic violence, child maltreatment, and other forms of violence beyond just sexual assault. So in 2015, when these nurse practitioners were hired, we had this vision, and we were presented with this amazing vision. The vision was provide follow-up care for the people seen by a forensic nurse. Then it was also to provide medical care to people who've experienced recent violence. Maybe they're outside of that 7-day window period, but they still need some care. And to be accessible and trauma-informed. This was the vision. We were like, okay, go forth and do this. Myself and a second nurse practitioner, we're like, well, what does a day-to-day look like? How do you find people who've experienced violence? Next slide. All right, so here's my question. How do you advertise? Well, networking was key. You can't very well put out a sign on a clinic door that says rape clinic. Nobody's walking through that. It's like walking through the STD clinic, right? You're not going to walk through that door. So how do you find these people? How do you find the people who don't go to the hospital for forensic care? How do you find them when it's been more than 5 or 7 days? And who's got time for doing all this networking? We're busy providing healthcare. And so that's one of our challenges. So I'm glad that we're here today and supported by our leadership to be here, because I think this is key. Many faces of Embrace Clinic over time. At first, we partnered with many different organizations. We were here in Abbotsford at the Warm Zone for a while. That was 2015 to 2017-ish. We were at the Surrey Women's Centre. We were at the Surrey Youth Clinic. We were in Maple Ridge at Alouette. We were all over the place. That was challenging because we had 2 nurse practitioners driving everywhere, and we were never sort of the same place 2 days in a row. So patients found it really hard to find us, and they kind of couldn't get the concept that we didn't have a home or a building with a sign on the door. We were this mobile service. And our unit clerk worked in the hospital in an office, and I saw her maybe once a week. What that did, it provided really great shoulder-to-shoulder collaboration, but we were also at the mercy of the other organizations, which is what happened when COVID happened. So when COVID happened, a lot of support organizations stopped seeing people in person. It's really hard to do a pelvic exam over telehealth. And so we said, you know, we still have to see and touch people. And so we needed our own space. And so in 2021, Fraser Health found us a building where we could put our name on the door. Next slide. That was the Embrace Clinic actual space. So we've been around since 2015. We've been in our own space since 2021. So we just celebrated our 10th year of service and our 4th year in our space. This is my colleague, Jennifer Bellefontaine, and my furry colleague who's with me today, Levi. So we are a specialty outpatient medical forensic clinic. We follow up after forensic exams. We see people whose incident was more than 7 days ago, but still recent. We don't have a cutoff line for like, oh, it was 3 months ago or 6 months. They need to be seeking medical care following the violence for something associated with that violence. So what we don't see is, I was hurt when I was 10 years old and now I'm 42 and I have PTSD. So we're not the PTSD clinic. We are not looking at historical violence. We're looking at outcomes from the most recent act. We see mature minors and adults of all genders who've experienced the recent violence or who are living at high risk for violence. And that includes some of our women who are survival sex working, maybe have precarious or homelessness issues, are maybe in some cases escorts who are at precarious risk for violence. And that sort of, we can put them under our umbrella a little bit. Next one. All right. What do we actually do? We do general medical care, lots of strangulation assessment, lots of head injury assessment. We are often the first person diagnosing concussion. As I said, no insult to my emergency department colleagues, but they miss the concussion. They miss that. And when it's not diagnosed on a medical record, how do we prove to Crown that this was actually a really serious, potentially life-altering hit to the head when physician hasn't documented possible concussion? Right? And so I go through the whole concussion assessment with them and I determine if they have a diagnosis of concussion or not. And then I follow them as long as they get back down to baseline. So it's not just a one-time visit, but we don't attach them as their healthcare provider. We are still a specialty clinic, but there are patients I've been following for 5 or 6 years because they are so vulnerable. I'm probably the only healthcare they get. But there's also patients, we just see them for one quick visit. That's all they really need from us, and that's fine. So it's basically till they're back down to their baseline. We draw our own STI blood at the clinic, so we don't send them off to Life Labs unless we need additional bloods other than things like HIV and hepatitis. We do a lot of pelvic exams and STI screening. We answer lots of questions. We give notes for school and work when we need to. We will do some documentation of injury. We at this time don't have capacity to do a full forensic exam with specimen collection. We don't maintain a chain of custody at the clinic. So a full forensic exam needs to be done at the hospital with our really skilled forensic nurses who have time unlimited. Our first initial appointments at Embrace Clinic are 45 minutes to an hour long, right? So we give time, and that's purposeful because these patients need time. All right, where we are today. This is our Connecting to Follow-Up booklet that was updated last year, and patients get this on discharge if it is safe for them to take home. It is also published on the website. I think Christina gave out some cards earlier. Website is also on the Embrace Clinic pamphlet. So fraserhealth.ca/forensic nursing or fraserhealth.ca/embrace clinic. All roads sort of lead in that general direction. And all the information that I'm talking about here today is also on our website. But the Connecting to Follow-Up booklet is also on the website. So if it's not safe for someone to take that home, they can do that too. And our website was updated about 6 to 8 months ago, and so it should have the most recent information on it. Next slide. Thank you. This is Embrace Clinic. This is Tara and Lorena working in the office. So we collaborate really closely with Tara and Lorena, who are the coordinators of the Surrey Forensic Nursing Service, because they sit on site. Their offices are on site at Embrace Clinic. This is, next slide, the reception desk and one of what we call the large exam room, which is really large. All right, next slide. Okay, now that we're in one physical location, it's easy for people to find us. We offer phone appointments. So if people cannot travel from Abbotsford or Chilliwack to come to see us, we do offer phone appointments. Sometimes if we think they need to be seen, we can arrange a taxi cab, or we have networks within these areas, usually other nurse practitioners, that we can send people to for a quick hands-on. So, hey, can you just look in this person's ear? I'm worried about their ear. My colleague will look, and then I will continue their care by phone or telehealth. We opened the strangulation clinic in 2022 specifically to name this type of violence and a specific place for people to be able to go. Next slide. This video here is a CBC video of the strangulation clinic and the opening of the strangulation clinic. We introduced Levi about 3 years ago. He is 6 years old. You are welcome to pet him if you're okay with dogs. He is providing patient, staff, people support. He will shed all over your nice black pants. I do have a roller in my purse. But these are some pictures. These are some pictures of Levi at work with patients who gave permission for me to take some pictures. Next slide. There's our updated resources. We have follow-up videos in 5 different languages about head injury, strangulation, what happens after your forensic exam, and caring for basic injuries. And those videos, we had a BC Civil Forfeiture grant to create those, and then they're voice-overed in the 5 most common languages in the Fraser region. There's also a section on our website for professionals. So police, victim service workers, Crown Counsel, you've got some questions. How do I get records? How do I get a patient or a victim to you? We've got all that information on our website. Next slide. Amanda had mentioned that we're involved in a lot of research. In the last 4 years or so, I've become very involved in research with UBC as well as Fraser Valley, we're UFV. We do a lot of data analysis, but we're also trying to find a blood biomarker that could help us diagnose and maybe provide prognosis or determine severity of brain injury from strangulation, which is a anoxic brain injury, lack of oxygen, or from hits to the head like concussive type brain injury. Having an objective measure is helpful not just medically, but potentially legally. Right now, I can prove someone had their wrist broken by showing an x-ray, but I can't actually prove that someone has a head injury other than a list of subjective symptoms. Do you have a headache? Are you dizzy? Maybe I can do a dizzy test on them and they're dizzy, but how do I know that you're in pain? Because you tell me you're in pain, because your face is wincing like you're in pain. But that potentially could, and as we know, many women are not always believed. So could she be lying? Yeah, I can't prove that she has a head injury other than my symptom checklist, right? So having a diagnostic tool would be available. All right, I'll try to whip through this part. But an appointment in Embrace Clinic, first of all, nurse practitioners have the same scope of practice as family physicians, with the exception of delivering babies. And no one does that anymore anyways. So I can prescribe everything a family doctor can prescribe. I can refer and order tests and imaging for everything that a family doctor can do. So nurse practitioners really are a key part of our program because we provide that upper level medical care, and anything that's out of the scope of the registered nurses and the forensic team often comes to us and we manage that. So when patients come to us in person, they're welcomed, always seen alone for the first 2 minutes by policy, always. We talk about confidentiality and limits. We describe ourselves and the role and what we're going to talk about today. And then they're invited to say, hey, is there anything you want to tell me that you don't want your other person to hear? Or do you want that person in here or not? We try to minimize that pressure or coercion for having someone else present with somebody. And so we review a quick intake form, and our intake form is like medications, medical conditions, and allergies. And then we talk about the reason for visit. And like I said, these are the topics we go through with every visit, the initial visit when we meet them. We want to know what their current safety is, what their current support systems, both formal and informal, are. We sometimes ask permission to talk with those services, what their physical signs and symptoms are, how they're emotionally doing, what their sleep is like, and then we review their hospital visit. Next slide. I won't go through that, but that's what we actually do. Next. And I'm going to touch on Angela's presentation from this morning, but here's the ways that we actively try to be trauma informed, and I need to update this to trauma and violence informed. Thank you. So we do appointments in person or by phone. People can contact us to schedule a conversation by phone, text, or email. We cannot provide medical care by text or email, but we can arrange appointments or, hey, can I call you right now by text? We do not need an MSP or ID. Because we're nurse practitioners, we're paid on salary. I get the same paycheck every 2 weeks. I am not a fee-for-service clinician. That's also why I can see people for 45 minutes to an hour. I don't bill per visit. Right? And so we also don't need that MSP or that care card. It does limit some of the medical care we can do, like ordering certain tests is gonna need a care card because that's how it's paid for, but my visit doesn't cost anything. Our intake form always has qualitative info. So instead of asking what your sex is, we just have a blank space that says gender. How do you prefer to be called? Our washroom is gender neutral. Patients are always seen alone for the first few minutes. We have a very small casual team, and Levi is present if somebody wants him or not. He sleeps a lot, and so he just sort of, his presence is there. We also have clinic rooms that have curtains between our exam and our table door, and that's in case, we're doing an intimate exam and someone decides to walk in. You never know when that happens, and we can't have the door locked. So we always make sure we have a curtain between there. Like I said, we have lengthy appointments. We have nondescript pictures on the wall. We try to limit the amount of posters and signage we have. We're very attentive to language. We have the ability to dim our lights in the clinic rooms for people who may have a head injury and it's hard for the lights. And we have free parking for our patients at the hospital. That's pretty cool. So finally, if you want to send somebody to us, the person can call themselves. Or you can help them call. If you're calling them on their behalf, we need their permission to be able to. We need their consent to see them, essentially. People cannot, please don't refer someone who doesn't know that you're doing that. So we just need to make sure that we have that. If you prefer referral forms, there's a referral form on our website as well. You can fax, you can email, you can text us, and we will try to arrange an appointment. Typically for people who've been recently hurt, we have same day or next business day appointments. We can often accommodate them. They may not have a lot of choice in time, but we can often accommodate them within a few days. Right. And so finally, and this I think is where we're going to head this afternoon, is that violence is still not routinely seen as a healthcare issue, and yet we very much know that it is. Our systems are not supportive or designed to help people fleeing violence. Any victim service providers here will know this. The amount of roadblocks and things that victims have to do just to sometimes maintain their life or their finances is sometimes insane. We had, until recently, no or very limited social work. And I would say, pick your jaw up off the floor. We're the violence program, and we have no social worker. We've just been approved for a pilot project to have a social worker on site for 4 days a week, which is very exciting. We are a teeny tiny program, which means we're super collaborative and we're super tight. We're all friends, but it is a higher risk for burnout when all of this work is on a very small amount of people. We are not a money-making sexy issue. These are not the patients going to the media screaming about why they couldn't be seen or who isn't seeing them or what's not happening, right? They might do that 5 or 10 years later when they've found their voice again, but these are not the patients who have large voices. They may not be the patients who vote either in some cases. And so they're often it's a very hidden system. NPs and nurses are not acknowledged consistently in our legal systems. And I'm sorry, I point at your police officers here. I think police start to see nurses as experts, but our Crown and our justice system does not look at nurses and NPs. We are very poorly paid in comparison to other healthcare providers in our legal system. And yet our nurses have years of experience and highly specialized training to talk about this work. And so we're very much excluded sometimes. We have definitely fragmented systems. That was what this whole panel was talking about. And I think that's what we're going to start talking about this afternoon. Our no-show rate at Embrace Clinic is high. These people are in crisis. They're overwhelmed by the number of phone calls and services that reach out. If you can imagine, you've been hurt and now you get a call from Embrace Clinic. Maybe you get a call from the hospital. Maybe you get a call from police. Then you get a call from Crown. Then you get a call from MCFD. Then you get a call from your victim service worker. And then you get a call from the other victim service worker because one's police-based and one's community-based. And oh my God, no wonder nobody can keep it straight. No wonder it feels overwhelmed. So we have a vision, and our vision for the future is a family justice center type model, which is similar to the American and the European, not the Canadian Family Justice Center, but like where in the United States, they have family justice centers where all of us services are sitting in one building. They have weekly case conferences and they rub shoulders with each other and they say, hey, here's what I know about this person, or I have information for your case, or like how do we provide wraparound housing for this person? And together we work together with multiple services in one place. And Amanda, I think that's it. Sorry. Done.
You don't need a personal health number, like the client doesn't need it to come in. What if, do you guys see new immigrants, temporary visitors and stuff who have been impacted by
Yes.
sexual violence
Yeah,
and they
so-
don't need any health care coverage?
No, so the question is, do people who are maybe undocumented or new immigrants, refugees who, or even travelers from visiting from Switzerland who've come here and they maybe were hurt, we will see any of them for their medical care. The limitation is that things like certain lab tests outside of STI screening has to be paid for either privately or by a care card. I have no way of getting a free complete blood count or thyroid or iron test. I can do STI screening for free. I can't get an ultrasound for free. That's paid for either privately or by your care card. So I do sort of, when I see people who don't have healthcare coverage, I work with a hand tied behind my back, but we do the best we can. So I followed a woman for 3 years with a seizure disorder who had no medical coverage. And all I could do was use a network friend and say, what do I keep doing? And I just kept prescribing for her until she was able to get her coverage and then get brain surgery. 3 years. But, you know, we do what we can with that hand tied behind our back. But no, we don't ask for ID. We don't ask for healthcare cards. Same with the forensic nurses. So if you have someone who is undocumented or doesn't have valid MSP and they've been hurt in our community, they do not have to pay in the emergency department for their forensic exam. Do they have to pay for their emergency care, Crystal? Not in Surrey, okay, and not in Abbotsford. So if they come and they've been like beaten up or sexually assaulted by somebody in our community, even if they're not documented or they're a visitor or traveler or whatever, they shouldn't have to pay to get some basic medical care done. And then the forensic exam. If they are, or you've got a registration clerk who hasn't been updated on that memo and you're advocating, you can say, please call the forensic admin on call and ask them. We have somebody on call on the phone within Surrey and Abbotsford 24/7, and they will help to navigate that situation. And in the minority of cases where a bill has been sent, we work with our leadership and they get it reversed.
Okay, so that was my question. Like if they show up to emerge, they always ask for the care card. And a lot of people are reluctant to even go into emerge when they don't have coverage,
Yeah.
saying like, we can't even afford this. So
Yeah.
then so you're saying they should be saying we need to talk to a forensic nurse for that?
Only if they're coming for a forensic exam or they've been.
Okay,
for-
yeah, like
yeah.
for that purpose. So
Yeah.
obviously, yeah, okay.
Yes. I know, I'm not sure, it's not something you can advertise, right? But at the same time, for all you service providers, if you have someone who doesn't have valid MSP, we will still see them and get their basic needs met. Any other questions?
Okay, thank you, everybody. Great questions again. I'll just take a very quick moment to wrap up because we are over time, but I just wanted to thank everybody again for coming. A special thank you to all of our presenters. Please don't run away because we do have a gift for you. We will get that to you afterwards. For those people that are here in the room, we have a separate meeting happening a little bit later this afternoon. So our service providers and other presenters will still be in the room for about 20 more minutes if you wanted to just quickly hit them up for any follow-up questions. Anybody who's online, please email me if you have any other questions, and we'll make sure to include some responses to those questions we weren't able to answer today once we send out the link with the recording to today's presentations. And I just wanted to thank Amrit and Bethany as well for all the hard work they did getting this meeting going. Thank you so much. And Christina and Tiffany were also key players in getting this event organized for today, so thank you very much for that. Thank you, Caitlin, for jumping in at the last minute to help us as a student volunteer. And thank you to Colin for figuring out the audio-visual needs. We got there eventually, people. But I also just want to thank everybody in this room. Sincerely, thank you so much for being here today, for taking the time to come and listen to our various presentations, to learn more about the Forensic Nursing Service. Thank you for asking great questions. Please continue to connect with us. Let us know about your other needs for education. Please fill out the post-event survey. The link is up here. There's hard copies here you can fill out and drop off with the students at the back. I will also be emailing you again tonight with the post-event survey. We would love to hear from you about what you thought about the event and what other events you would like to see. So thanks, everybody. Have a great rest of your day. Thank you.